Mommy Track Daddy Whispers podcast is now called Birth Agni Podcast.
Welcome to Mommy Track Daddy Whispers podcast season 2.
As long as the baby suckles, your breast will be producing milk. Okay, the flow might differ because the fore milk, sometimes the letdown of the fore milk is faster and the hind milk comes slower. That difference can always be there.
My name is Divya, and in the last episode, we discussed about some of the common concerns around childbirth, the importance of labor support, the mindset of a woman, the idea of positive birthing, and much more. And today we have gathered together to discuss another very important stage in a new mother's life, in a new parent's life, which is feeding your baby, which comes with tremendous confusion, lots of unsolicited advice, which puzzles and confuses a new mother all the more. Therefore, to cater to some of the common concerns around breastfeeding, we have with us today Saumya Dwivedi, who is a master's in biotechnology. She was a former researcher at IIT Bombay in neurobiology, who shifted gears to help more and more women out there and became a certified lactation counselor and a baby wearing educator. Saumya, welcome to the show.
Hi Divya, thank you for having me here.
Saumya, you work at a hospital as a lactation counselor, right?
Yes, I work at a hospital, and because I am at the hospital setup, we do have a lot of babies in, say, the NICU and who have special needs for feeding, like there are preterm babies, low birth babies, and so on. So there are a range of issues that we cater to, and I'm trying to do as much as I can. But yes, we need a lot of awareness around this topic. So I think this would be one effort towards creating more awareness, towards creating more knowledgeable women who can choose to take their decisions and implement it with full confidence.
Yes. I did not know a lot of things when I was breastfeeding. I chose to exclusively breastfeed, but I did not know if I could have taken another option. So, Soumya, tell us about what is that suggestion that you give new mothers right after postpartum, right when they are into postpartum? What should they do?
So, Divya, one thing which is very important, postpartum तो जानना जरूरी है ही, but I think this is a decision that you take when you are actually pregnant. The last trimester is the golden phase when you should be ready with your birth plan. You should be ready with your feeding plan as well. Because most mothers, they don't give a serious thought. When I say serious thought, it's not in the sense of criticism. It is with the sense that we do not give it a very practical thought. And many a times women don't realize how challenging it's going to be. And whereas there is this another crowd who's very relaxed and chilled out, and they know that they are going to mix feed or formula feed or breastfeed, whatever. Like, it's not an informed choice. It's just that they decide once the baby is out. They just decide based on their situation at that moment.
Yeah, or instinct.
And that might not be the best decision, I would say. So preparing ourselves right through the pregnancy is a very good idea.
Yeah, and how do we prepare ourselves right from the pregnancy?
A good idea would be to keep yourself informed about the choices you have. So if you want to breastfeed, if you want to go for a mixed feeding, if you want to formula feed, whatever pros and cons are to each of these ideas should be very clear in a woman's mind, so that she can decide what she wants to do. And then accordingly, she can prepare her body, she can prepare her mind, as well as her circumstances. So say something like keeping the people informed who are around you is a very good idea. So the mother, the primary caregiver, and the secondary caregiver should be knowing what is to be done, how the breastfeeding journey is going to be, and how do you initiate the breastfeeding on the first place. So that has to be very clear in the head. if we are trying to go ahead with it.
Okay.
Yeah.
So when we talk about letting everybody know, we are trying to emphasize on the fact that it kind of de-stresses us when there are challenges in the choices that we make.
Yes, that is one thing. Another thing is that once the baby is out, you don't really know what to do. And then there are different set of protocols in different places. So if you're going to a baby-friendly hospital, then they would ensure that the baby is roomed in immediately. And that is one thing which is very, very important also. Another thing to it is that if you really want to initiate breastfeeding early, which is actually the best decision to make if you really want to go for a problem free breastfeeding, it's a very good idea to initiate it in the first 1 or 2 hours after birth. In fact, what I generally do at the hospital is once the baby is out, we immediately place the baby on the mother's tummy and we go about doing what is called a breast crawl. So, a breast crawl is something which is common across animals of all species.
Okay.
In fact, Divya, I would want to ask you, have you seen any animal give birth?
No,
No.
no, not in real, just in discovery, probably. No.
राइट तो कोई भी एनिमल जब बर्थ करता है उसके बाद once the baby is born, the baby starts looking for the breast. The mother slightly probes the baby towards the breast, and the baby is able to find, locate it, and initiate feeding.
Okay.
Now, humans are considered to be the most intelligent species, right?
Right.
Why at all do we believe that our babies will be unable to do it? The problem is with our mindset because human babies can crawl, find, and latch on their own. The problem is that we do not give them enough time to do this entire task. So that is one thing which really needs to change around us. And if we can bring this about, and if you have more questions on it, then we can definitely go forward.
Yeah, and the moment you said the baby can crawl and latch and find the breast, I kind of had this thought that we have, in a way, with our mindsets, or just the way you said, distanced ourselves from what is natural.
Yes.
So this should have been naturally possible for us. And that's the same for childbirth. It's a natural phenomena. It kind of perplexes me. And I think that is the reason we are here and we are talking about it. So, Saumya, can you explain to us how can one prepare a feeding plan? What should be in it?
So, when you're preparing a feeding plan, what you need is to be informed about what are the pros and cons of each of the methods we use for feeding. So, when we talk about breastfeeding, of course, everybody knows that breastfeeding is the thing to do, and it gives baby a lot of immunity, and the list goes on and on, right?
Yeah.
It does meet the psychological needs of the baby, so on and so forth. But there are a few points and there are a few common misconceptions which I have come across through my practice as a counselor, as a lactation counselor. And those are a lot of women are not aware about the benefits of breastfeeding to a mother. Now, general perception in the society is that the baby is drawing out so much from me. And you just feel exploited and you just feel overwhelmed as a new mother that I'm nothing but a feeding machine.
Yeah.
So when the baby is feeding, it's very important for a mother to know that the initiation of the breastfeeding and continuing of breastfeeding is actually a recovery process for the mother. Now, when I spoke about initiation of breastfeeding, the first, the first thing to note there is that when the baby is latched within the first few hours after the mother delivers the baby, whether it's a C-section or a normal delivery, the point is the moment baby latches, you have a letdown. And now, as the baby draws the milk, like it provides a lot of relief to the mother because of the release of oxytocin in her body. Now, this would also assist in the uterine contractions and it will speed up the process of placental delivery, and it will actually reduce the chances of anemia in the mother.
Okay.
Also, yeah, see, I generally put it this way, that your womb was very small in size, right? Okay, what I can see, maybe an orange, right? And then it just keeps on expanding, and it reaches the size of a watermelon.
Yeah.
Now, once you've delivered, a lot of females complain about things like, that loose tummy which is hanging out and things like that.
Yeah.
So I always tell my mothers that if they really want to work upon their fitness, if they want a gorgeous body even after childbirth, a very good thing to do is breastfeed, because then your uterus contracts and sits back in its place. All your joints which have been which become loose during the process of childbirth, they get back to their place. So it's actually a recovery process for the mother, and which is supposed to be relaxing also, because of something that I told you a while back, oxytocin. Oxytocin has a very calming effect on the body, and it is also the hormone which is going to make that bonding with your baby.
Yeah.
So when we talk about bonding, once again, that bundle of joy. So there's nothing like bundle of joy that arrives. Sometimes it is perceived as a bundle of troubles also.
Yeah.
Now, as you go about your journey with the baby, you bond with the baby. So the more skin to skin you give, the more breastfeeding you do, you release more oxytocin, which is the love hormone, and you bond with the baby better, and your body relaxes and eases out and recovers in the process.
Yeah.
I think knowing that is very important, that it's a healing process for the mother. It's not a burden to the mother.
Yeah. Let's not look at it as if the way you said it, it's a burden on the mother. And I think that's why they say, and in fact, I also experienced this. It becomes after a while, if you're used to breastfeeding, it's difficult to detach the child from you, because it's a kind of that warm feeling to be able to nurture a little being from you. The entire process of childbirth, breastfeeding, all of that is so miraculous, affirming the fact that all this is natural. Your children can figure out how to breastfeed, your bodies are capable. When it comes to, you talked about oxytocin, and does it also has to do with the mind? So women have to be in a certain space in their mind to be able to breastfeed smoothly, maybe.
Yes, of course. A lot of thing depends on the mother's confidence. So, I get a lot of queries wherein mothers say that, people around them told them that their nipples are inappropriate for feeding. They're
Me
too
too.
big, they're too small, they're inverted, they're
Yeah.
flat, things like this.
Yeah.
And the mother is unable to breastfeed. The
Yes.
reason is not the shape of her nipples.
Yeah.
Now, the trick is a confident mother. That's one thing, that's the only one thing that you need for successfully breastfeeding. That confidence that you will be able to do it is more than what is needed for a mother to breastfeed successfully. It has nothing to do with your supply, nothing to do with how your breast looks like, nothing to do with how you delivered your baby, because that debate that normal NVDs are able to breastfeed better than the C sections, all these myths around breastfeeding, there's just one reply to it. It's your confidence, and it's your mindset which is actually going to sail you through this early phase of postpartum.
Yeah, I delivered through cesarean. I was able to breastfeed exclusively for the first 6 months, and thereon, of course, I started to wean out of choice. So, yes, a lot of myths out there. To be honest, I did not know what is right and what is wrong. It came to my mind that I want to do it. I want to exclusively breastfeed. That was my choice. I was able to do it. I had a good supply. I often think that I was fortunate in that sense. And I was never able to understand, how do you figure out if you have adequate supply? I was told a number of times that probably, your child is crying because your supply is not adequate. But I was always leaking milk. So I was like, I mean, the child can drink as much as it wants. If it doesn't want to drink, I cannot help it. But since I'm leaking milk all the time, I cannot kind of agree to the fact that I don't have enough milk. So, how does one
Yes.
actually know if you have an adequate supply or not, to be able to make that informed choice whether to continue breastfeeding or to kind
So,
of, yeah.
Divya, I won't tell you what to do. I will tell you what not to do.
Yeah.
So, one very good example, which you yourself said, the people around you are going to tell you that something is not right, that you have an inadequate supply, and it is not true. So, like if you just Google up, you would know that your breastfeeding works on demand and supply.
Yeah.
If there is a demand, there would be a supply. Now, the baby's body and the mother's body are very closely connected. The moment baby attaches to your breast and empties it, when I say empty, it's not to be taken literally, because your breast is never empty. It cannot be empty. वो हम हिंदी में बोलते हैं ना, अक्षय पात्र होता है जो कभी खाली नहीं होता.
हाँ.
It is like that. A breast can never go empty. There will be some amount of milk always present in the breast. As long as the baby suckles, your breast will be producing milk.
Okay.
Okay, the flow might differ because the fore milk, sometimes the letdown of the fore milk is faster and the hind milk comes slower. That difference can always be there, but your breast can never go empty if your baby is sucking. If you yourself try and some mothers, they have a practice of pressing the breast and checking if they are producing enough. That's not a very nice thing to do.
Okay.
Because first of all, you would not know whether you're doing it right or not.
Yeah.
Second, you might end up hurting yourself. And third, when the baby attaches to you, the phenomena that goes on, the changes that happen in your body are slightly different, and the output that you will get out of it will be better. So when the baby attaches, you will surely produce some milk. I am repeating this again and again. I don't know why. So that is that about demand and supply, and the breast never being empty. So that's about demand supply. Now we come to the foolproof method of knowing whether you're producing enough milk or not. First of all, as I said, this question is not relevant because you always produce enough. Sometimes the baby is not able to take enough if the latch is not proper.
Okay.
How would you know if that is happening? There are multiple ways of doing it, but the best way of knowing whether the baby is well fed or not is having a pee count. Now, if your baby pees, on an average, it is 6+ pees through the day. That means your supply is adequate. And if still your baby is crying or is fussy, there could be multiple reasons for why that is happening. One very obvious reason, but which most people miss out, is that they don't realize that your womb environment is very different from the environment which the baby is getting now. The baby was swimming nicely in your womb with no light, very low sounds. And now that the baby is out, one is the birth trauma, which even the baby feels in some or the other way, right? And then is the shock of coming to a very different environment where you have so many other different stimulations around you. So of course baby can cry for many reasons. How would you know if you have a well-fed baby? Is when the pee count is 6+ throughout the day. Now one more point which I want to add here is that a lot of women go into taking supplements for breastfeeding. And you get so much of over-the-counter medications like Shatavari and this and that. And then on that, I would say that you generally do not need supplements. The best supplement that you can have is daily dose of your baby sucking onto your breast. That's the best supplement if you want to maintain your supply. And inappropriate use of supplements might cause a problem rather than help you in any manner. Because I get a lot of mothers who have an oversupply because they are taking supplements, and the baby is not drinking enough because of a poor latch, and then the mother ends up getting engorgement, and which is a very painful process.
Yeah.
So that's one thing which is important to note here. When we talk of supply, do not go in for any supplements. Just count the number of peas your baby is producing, and you should be able to satisfy yourself whether you're producing enough or not. That's the best answer you can get.
Yeah, leaving everything aside, just know how much your baby pees and probably the weight is increasing. So, yeah.
Yeah, yeah, of course. I mean, the weight increase you would know over time. Now, if you want calculation for the daily basis, it's pea count. For a long term, it's baby's weight.
Okay. So that's one thing that one we should pinpoint when it comes to any kind of confusion whether we are producing enough milk or not. So thank you for all that information, plus the line of caution that supplements can hurt, because I did not know if there are any supplements out there. And so that's, I think, a very important thing that you've mentioned. And thank you so much for that. And another thing that I sometimes wonder about is, since the baby latches for very, very long time, early postpartum. So my daughter, she used to latch for 45 to 50 minutes at a go, and she would not leave if I did not, take her off. And I was never sure if she was even getting any kind of milk or not. And I also kind of have this thought that probably that is something that also puts a lot of women off. I'm not producing enough supply right off the baby's delivery, and so let's not continue. So what would you suggest people in those circumstances?
So, like I said, when you introduced me, you said that I was studying, I was doing my research, and then the baby birth happened, and suddenly I transitioned into being a lactation counselor after almost 2 years of having my baby. I got myself into this.
Yeah.
So one very important reason why I did this was, of course, the challenges that I faced during breastfeeding. And the second reason was that while I was breastfeeding, I did know a couple of lactation counselors around me,
Mhm.
but I didn't know when is the time that you need a lactation counselor.
Okay.
So generally, our perception is that when you're facing any issues,
Mhm.
when there are some serious issues with you, is when you seek help. But Divya, instead, I would say if you're facing even the slightest of the discomfort, anytime you feel that this is getting unpleasant for you, or it's causing even the slightest of the discomfort, is when you seek a lactation counselor's help. So, coming back to the question where you asked that long duration of latching, that actually happens when the latch is not proper. When the baby is not deeply latched, the baby will take a lot of time to take the same amount of feed. And that again is something which is very obvious. If the baby is able to take how much ever, say he wants to feed 80 ml of milk. Now, if he's able to take that 80 ml in 8 minutes, good. But what if the baby is not latched properly and that 80 ml is being taken in 40 minutes? So that's where the problem lies. So that is the time when you go and you seek help of a lactation counselor. You improve your feeding position, you improve the latch of the baby, which will make things better for you. And if we talk about just ensuring whether the latch is proper or not, to give you a quick update on that, first thing that you check is whether your nipples are getting cracked or whether you have some pain while feeding. If you have pain in the nipples while feeding, that means something is not right. That means the latch is poor.
Yeah.
Second thing is that your areola, that should be at least three-fourth of it should be covered. If that is covered, you do not see much of the darker region on your breast after the baby is attached to you. That means you are in a reasonably good position. And of course, you just observe small things like, the lips of the baby, if they are curled outwards, if the baby is gulping down the milk or not. One important point again is feeding on the same breast is something which is crucial, and that is a mistake some women make sometimes, that they offer both the breast in one feed. That shouldn't be done, because there is a concept of foremilk and hindmilk. The
Oh,
foremilk is essentially, it's going to satisfy the thirst of the baby, to state it in layman terms, and the hind milk will take care of the fat requirement of the body weight, and it will actually, make the baby feel full in the tummy. So if you offer both the breasts, then that means you're giving foremilk and not hind milk, so your baby will be always hungry even after a feed.
okay.
So again, it is important for you to be informed that one feed, one breast, after which uh, you offer another breast maybe after, say, 2 3 hours or so. If you put the baby down and the baby immediately wants to feed again, you offer him or her the same breast and not the other breast.
Ah,
So
okay.
that's one practical thing that that a mom needs to know.
Yeah, I think I did that wrong.
A lot of us too, Divya.
Yeah, it's in the past, but I was just thinking that.
Yeah, like if I prepare a checklist now, I was like, gosh, what was I doing? How stupid I was. But it's a learning process. It's
Yeah,
a learning process.
yeah, I think it made us. I mean, especially you, it changed your inclination from research into becoming a lactation counselor. So I think that speaks a lot.
Yes, I had a tough time, dear.
And that ways you're helping so many women out there, and
Yeah.
yeah, that's commendable. And so Soumya, we've kind of discussed most of the issues, the early issues that women face. So we've discussed the latch, that is very important, the mindset, the need to know that you can do it because it's all natural. You do not need any kind of support to be able to breastfeed, except that it has to come in the form of emotional support. And apart from that, we've discussed some cautions, some things that we need to take care of. But now I wanted to ask you a question based on the current scenario that we are in. There's a pandemic and there's COVID, there's a vaccine that's out there. So there must be certain women who are breastfeeding. And what if they suddenly figure out that they are COVID positive? Can they continue to breastfeed? And what is the impact on their, you know, breastfeeding journey as a mother?
So we generally tend to get scared a lot. And if you get infected with any disease, even if it's a common cold or if you have acquired a disease which is infectious, then you are not going to transmit that disease through your breast milk. You might be able to transfer it, like for COVID, if we talk specifically about COVID, then of course we are wearing masks because it can spread through droplet infection and other such means, right? You can breastfeed even if you're infected with COVID. Your breast milk is not going to infect your baby in any manner.
Okay.
In fact, if you have the disease, then you are actually making your baby immune to that particular disease if you're breastfeeding the child, even if it's a common cold. The
Okay.
child might acquire that cold through your, I mean, because the baby is in direct contact of you. Another very good option would be to express breastfeed in this case.
Okay.
I mean, feeding the baby expressed breast milk. That's also a very good option, and that is something you would want to do, because with the scenario changing so much, I think it's a very good idea for mothers to now be more informed about breastfeeding and its benefits, because it is actually transferring immunity to your child. So
Yeah.
when you're giving breast milk, it's actually a vaccine dose that you are transferring to the baby for various diseases that you might have acquired in the past or present.
Okay. That's nature's way of making sure that the baby is vaccinated.
Yup.
Okay. Okay. So, Soumya, there's another thing that I wanted to ask you. Are there some factors that can lead to reduction in your milk supply or maybe increase?
Hmm. So When you talk about increase in milk supply, again, I would come back to supplements. Supplements are available. You can take them if at all you have a need. Second thing is, like I mentioned, breastfeeding is based on demand and supply. So if you think you have a low supply, then you should attach your baby frequently to your breast, especially during the postpartum phase, early postpartum phase. It's a very good idea for you to latch your baby frequently. And when I say latch your baby, all you need to do is just place the baby on top of you. That's it. One very important point why that doesn't work out for most females is because they are not relaxed. And that is a major factor for reduction in the breast milk supply. There's no reduction as such in the supply, but then the letdown doesn't happen sometimes if the mother is too stressed. So one thing that you really want to do if you want to feed successfully is relax yourself. Another thing which might affect is dehydration, because you really need to keep yourself hydrated when you're breastfeeding. Eating more is not a good idea, and that is not going to increase your milk supply. It is just going to increase your fat. So that is one thing which we really need to keep in mind. One thing breastfeeding can help you is getting back in shape, because you'll be burning a handsome amount of calories when you're breastfeeding. So you will feel hungry. You should eat, and you should eat healthy, and you should happily continue to breastfeed is what is the ideal thing to do.
Yeah, wonderful. So there isn't anything that should actually reduce the supply. It should all be in the mind. So if we are prepared, the one thing that you mentioned in the start, the importance of preparation, when it comes to breastfeeding and having a feeding plan, knowing what you want to do, can be great stimulus, can be a great way to have an adequate supply, to be in the right place and to take the right decisions without being confused and without just going instinctive, just the way I did. And
No, it's good to be instinctive. It does work out sometimes, but it's equally important. So like you said, Divya, that you were lucky that you were able to do it and you were able to sail through it comfortably.
Yeah.
But sadly, it is not same for all the mothers. Mothers out there, they face a lot of challenges. Like, I'm lucky enough to be able to interact with more than 20 females in one day. I think that's a huge number for a counselor. And there are a number of issues that a woman goes through. So when I say that, and why I say that is because when you are in that situation, what is going to help you is your knowledge. What is going to help you is that you should know why you are doing what you're doing. Because in moments of low, like if you decide to exclusively breastfeed, but somehow you're not able to do so, that will be a moment of low for a mother. That will be a moment which will shatter her confidence. So it's very important that you know that you are informed about your options and when to switch options. Like, when should you be formula feeding is also equally important to know, as is the fact that you should breastfeed and all of that. And I would say it is a personal choice, that whole idea of my body, my choice. But even a baby has certain rights. So if we talk about that, I think every baby has the right to be well fed. Well fed might mean breastfeeding, but well fed might be formula fed in some cases. But knowing when you would want to do it is something which is very important. Generally, I find females making wrong choices based on wrong notions of themselves. Like, I have come across moms who say that their figure is going to get distorted if they breastfeed. Then they say that they want to go back to work after 3 months or 4 months or 6 months, which is why they want the baby to get used to formula feeding and get used to top feeding, so that things like this can be managed. So I think these are not the points where you should be deciding to formula feed. Formula is meant for special circumstances. It is not like, even the formula says that breast milk is the best substitute thing for the baby. And all these are substitutes. So a wise decision when you should be going for the substitute is very important. So I am not against formula feeding. The decision should be taken wisely, is what I would say.
I think that that's a wonderful advice. And I definitely agree with you. Whatever choice women make, the best way to go about it is to know that it's the best for you as well as your baby. So you don't come out later thinking that, okay, that would have been a better choice for me, my body, maybe my work too. So, yeah, any other advice, Saumya, you'd like to give as a final note as we wrap up this episode?
I don't know. I don't like the word advice, because as a new mother, the one thing that you get overwhelmed with is advice.
Definitely.
So I think that is one thing most of us hate it, right? But if at all we are going to talk about it, I think one thing that I'm going to tell them is to be informed, and to have that knowledge, so that you can know which advice is worthy of implementation. Another thing is that when moms ask me, I tell them the best time you can travel is the first 6 months after the child's birth, because you do not have an extra baggage with you. Like, you don't have to worry about what to feed to the child, the hygiene, the this, the that. All you need to do is pop out your breast and just chill.
Yeah.
So a mother should not consider herself that she is aloof, and she's cut off from the society, and she's supposed to sit there and cover herself up and nurse her baby. That's not what you're supposed to do. Just be right out there. I remember once I was in the middle of the square, and since I have been a baby wearer, I had a carrier with me. I was wearing my child in the carrier, and I was waiting for the cab. And I was feeding my child. My child wanted to be fed. I was crossing the road, feeding the child, and I stopped on the divider, and I stood on the divider, and I was watching around me, people coming and going, giving me glances. And Divya, somehow that was one moment for me which was life-changing in some way, because that I'm standing in the middle of the square with people looking at me as if, I've committed a crime, but all I was doing is feeding my hungry baby.
Yeah.
And yeah, I just I located my cab. I just went smoothly and sat inside the cab and continued to breastfeed. It's a part of me. It's a part of my journey. It is not something which is going to stop me from doing what I want to do.
Yeah.
Neither having a baby nor the decision of breastfeeding my baby is something which can make me confined in four walls of the room. So I mean, I really suggest mothers out there to change their perception about breastfeeding. It's something which heals you. It's not something which makes you dependent. It's not something which confines you. So I think that is, yeah. Should I be saying more? I don't know.
I think I'm just lost in the imagination of how empowering that is. And that's a wonderful way to look at it. And I think that's what we need. We need to align our motherhood with our freedom. And that's, I think, the most difficult choice. And I mean, it kind of becomes difficult in the kind of society we live in. But it comes down to how we perceive ourselves, how we perceive the world around us. So, Saumya, thank you so much for giving us that piece of wisdom, that piece of empowerment. And I really think it will help women reimagine themselves. And I think a lot of us are already doing that. But yeah, just the way it is. Yeah. Thank you.
Thank you, Divya. Thanks a lot.
This episode was all about breastfeeding, the importance of the psychological state of a woman's mind throughout the phase of baby birth and nurturing. We hope we have been able to answer some questions for you. But if you still have some outstanding questions, please feel free to write to us at mommytrackdaddyWhispers@gmail.com. We come from a place of bringing value and awareness. If you think you are able to find the same value out of our episodes and the knowledge that you need, please share it with somebody who will also benefit out of this. In the next episode, where we come with our second theme, which is Ask Your Gynecologist, we are going to discuss about choosing to be first-time or second-time parents in your 30s or 40s, which is the effect of age on our reproductive health. So if you think this episode will be relevant to any of your friends, relatives, please feel free to share and don't forget to subscribe. And remember, all you mamas out there, you got the power. It's natural. Bye-bye. Stay tuned.